Welcome to Part 2 of Section 4, which will cover the treatment of sick or injured horses. Moving on now to Section 4.2, which addresses sick, injured, or compromised horses. Early detection is key to successful treatment. For this reason, horses must be assessed as often as required for health and fitness relative to any work or activity they perform. You should inspect stabled or group housed horses at least twice a day for health and well-being. These inspections can be done during feeding or other chores. Horses on open range or pasture also must be observed on a routine basis, though frequency will be less than horses stabled that have daily interaction and are easily accessible. It is essential that those responsible for horse care are able to recognize normal behavior, signs of sickness or injury, and have basic knowledge of first aid for horses. The most common signs of illness include change in the horse's behavior, such as they are lethargic, depressed, or anxious, reduced feed intake or change in water intake, a change in consistency of manure, such as it becomes loose and watery, unexplained weight loss or gain. They exhibit signs of pain or discomfort, such as reluctance to move, increased rate of respiration or sweating, signs of colic, lameness, swelling, discharge from the eyes, ears, or nose, coughing or difficulty breathing, or fever. An information sheet on vital signs in horses and donkeys can be found on the resource page. Compared to horses, donkeys and mules are stoic animals and are less likely to show behavioral signs indicative of illness. In donkeys and mules, a reduced or loss of appetite is a significant concern. If any horse is injured or appears ill or distressed, you must take action immediately. If you are in doubt about the horse's health or the most effective treatment, consult a veterinarian without delay. The code requires that any equine that are sick, injured, or in pain must receive appropriate treatment without delay or be euthanized without delay. For sick, injured, or compromised horses that are not showing improvement, horse owners or caregivers must, without delay, obtain veterinary advice on appropriate care and treatment or make arrangements for euthanasia. Any suspected or confirmed federally reportable diseases, such as equine infectious anemia, must be reported to the appropriate authorities immediately. Please refer to the Canadian Food Inspection Agency for more information at www.inspection.gc.ca. Based on the recommendations within the code, you should consult a veterinarian when vital signs are abnormal for an unknown reason or when a horse shows signs of illness. Post your veterinary contact information, including after-hours contact, where staff will easily see the information. Know in advance the route to the nearest veterinary hospital and have a plan in place for transport if you do not own a trailer yourself. And you should keep a first aid kit on farm and in the transport vehicle, ensuring that your staff knows its location and how to use it. If you will be away from the farm for an extended period of time, you will need to assign responsibility for health management decisions to a competent individual. When treating a sick or injured animal, Consult an experienced horse person or other expert for advice on safe restraint during treatment, and provide an appropriate means of restraint when a veterinarian attends the horse. This can include tying the horse up or placing them in a chute designed to restrain horses. You should have access to a sheltered, segregated, and well-bedded sick pen or stall for horses that are sick, injured, or recovering. This allows for easy access and monitoring of the horse during treatment and recovery, while providing protection from the weather and other horses. Sick, injured, or recovering horses should be checked on at least twice a day. All farms should have isolation facilities available for the segregation of both sick animals and new arrivals to the farm for their quarantine period. And finally, as with preventative medicine, all treatments should be recorded, including a record of the animal treated, the date of the treatment, the reason for the treatment, the product used and dosage, what the withdrawal time is, if applicable, and any adverse reactions the horse may have experienced. Colic is probably the most commonly recognized condition that a horse owner may face. It is a sign of a painful condition in the horse's abdomen, and while episodes of colic vary in their severity, every case should be taken seriously. The most common signs of colic are when a horse is repeatedly lying down, rolling, and getting up or attempting to get up, turning their head toward the flank, kicking or biting at their belly, pawing at the ground, stretching out as if to urinate without actually urinating, acting depressed with a loss of appetite, diarrhea or any change in manure output, and sweating with minimal physical exertion. To reduce the risk of colic, you should provide safe, palatable, and clean water at all times. Water consumption is vital to a horse's gut health. Maintain a consistent daily schedule for feeding, exercise, and turnout. All animals do better on a set schedule with limited disruption. Make sure you feed a high-quality diet consisting primarily of forage while limiting the amount of grain-based feeds. When feeding grain concentrate, divide the daily ration into 2 or more meals spread out in the day. Avoid putting feed directly in contact with the ground, especially on sandy soils, as consumption of sand can lead to colic. Ensure your feed sources are free from mold and spoilage, and maintain a parasite control program in consultation with a veterinarian. Communicable diseases are diseases that can be passed between animals by direct contact or by indirect means, such as an insect. The most common equine communicable disease are infectious respiratory diseases and equine infectious anemia, otherwise known as swamp fever. Any horse with a suspected or confirmed communicable disease must be isolated immediately. You should seek a diagnosis, provide treatment, and alert any owners of horses that may have come in contact with that horse. Young horses and horses that commingle with others, such as at a horse show or if living in high-traffic barns, are at particular risk for respiratory infections such as influenza, equine herpes virus, and strangles. These infections can be spread in the air, by nose-to-nose contact, or by contaminated hands, clothing, equipment, and tools such as feed buckets, water troughs, and grooming tools. Signs of respiratory infections include fever, lethargy, nasal discharge, cough, and swollen lymph nodes under the jaw, especially with strangles. With some diseases, the infection can be spread by horses that are not showing any clinical signs. For this reason, testing is often necessary to obtain a definitive diagnosis. The time between exposure to infection and the occurrence of signs, otherwise known as the incubation period, can vary from a few days up to 2 weeks. Prolonged rest periods after infection are often needed to prevent chronic problems. While many horses recover uneventfully, if not managed properly, some horses can develop life-threatening complications. Horses showing signs of respiratory infection should be strictly quarantined and should not be worked until a diagnosis and treatment or management plan have been established. Equine infectious anemia, otherwise referred to as EIA or swamp fever, is a contagious viral blood-borne disease. The most common signs of it are fever and anemia. However, horses can appear healthy, but still be carriers of the infection. This disease is most commonly passed between horses by blood-feeding insects, such as mosquitoes. Transmission may also occur via contaminated instruments, such as reused needles, or transfusions of untested blood or blood products. Unfortunately, there are no licensed vaccines or treatment for equine infectious anemia. In order to prevent the spread of the disease, testing is strongly encouraged, particularly in areas where there are known cases. Infected animals are identified by a positive blood test known as the Coggins test. A negative EIA test is required for export of horses and to enter many competitions and stables. Equine infectious anemia is a federally reportable disease. All suspected or confirmed cases must be reported to the Canadian Food Inspection Agency. Horses that are confirmed EIA carriers must either be euthanized or kept in permanent quarantine in accordance with CFIA protocols. The next aspect of health management we are going to address is dental care. Dental care is important to the overall health of your horse, as most dental conditions are painful and lead to other welfare issues such as weight loss. Proper dental care helps horses eat better, perform better, and be healthier. Horses should have their teeth examined at least annually and receive appropriate dental care as needed, which is most commonly teeth floating. Young and old horses, broodmares, horses entering training, as well as those with dental problems, may need to be examined more frequently. The code requires that dental care procedures only be performed by a veterinarian or competent individual working under direct veterinary supervision. Refer to provincial regulations for specific detail. Horses should be observed regularly for signs of dental problems. Signs of dental problems include unexplained weight loss. They drop their feed while chewing, which is also known as quitting. They are reluctant or slow to eat. They have an unusual tilt of their head while chewing. There are unusually high amounts of long fibers in their manure. They show resistance to the bit or bridle due to pain. There is swelling in their cheeks or their jaw, and there is an unpleasant odor from the mouth or nostrils, with excessive drooling or slobbering. Horses showing signs of dental problems must be examined and treated. Section 4.4 in the Code is dedicated to lameness. For the purpose of this code, it is defined as any alteration in the horse's gait that appears to be caused by pain or discomfort. Lameness can manifest as a change in performance or willingness to move, head nodding, or hip hiking. Their gait can be evaluated from a walk, moving in a straight line, and turning in both directions. A trot may be necessary if the lameness is less severe. Lameness is a significant welfare concern, and identifying the source of the lameness is essential to proper treatment. Prompt examination and diagnosis improves the welfare of the horse and can save time and money and prevent further damage. A veterinarian is best to assist with the diagnosis of the cause of lameness and on appropriate treatment. Lameness must be addressed either through specific therapies or changes in management or workload. There are various forms of treatment for lameness, including rest, medication, surgical procedures, corrective trimming and shoeing, rehabilitation exercises, and pain management. Pin firing, which is burning, freezing, or dousing a leg injury with acid or caustic chemicals, is not recommended for treating lameness. The procedure itself causes pain, and there is very little scientific evidence that shows that pin firing is beneficial. As with everything else, an ounce of prevention is worth a pound of cure. You can reduce the risk of lameness by taking into consideration the horse's physical condition and soundness when determining the type and amount of work the horse will be asked to do, ensuring that immature horses are not worked or trained excessively, provide horses with adequate rest periods between work sessions, ensuring there is good footing in exercise and turnout areas, perform and schedule regular hoof care, and allow low-grade injuries to heal by giving horses appropriate rest periods. One of the most serious conditions resulting in lameness is laminitis, commonly referred to as founder. This is a condition that causes inflammation in the foot that often results in severe pain, abnormal foot growth, and lameness. If left untreated, or if treatment is unsuccessful, laminitis can lead to permanent structural changes in the foot, gait abnormalities, and continual or recurrent bouts of foot pain. In the most severe cases, the pain from laminitis can become severe enough to necessitate euthanasia on humane grounds. Known or suspected causes of laminitis include grain overload, obesity, severe infections such as acute diarrhea, equine metabolic syndrome, or equine Cushing's, and excessive concussion of the hooves. Diet plays a key role in triggering laminitis, particularly with the consumption of pasture or feeds high in simple sugars, starches, and fructans. Signs of acute laminitis include lameness, including a cautious, stilted gait, increased palpable heat in the feet, a bounding pulse in the feet felt at the pastern or fetlock, shifting weight to the hind end, front feet stretched out, and reluctance to pick up the feet. Horses with laminitis must receive appropriate lifelong management and treatment, which may include medications, dietary management, and hoof care. You can reduce the risk of laminitis through the following strategies. First and foremost, do not let your horses get too fat. You want to ensure they are at an ideal body condition score and are not overfed relative to their energy needs. If changing their diet, make sure that any changes to the diet are gradual. Restrict any at-risk horses from grazing on lush pasture, such as grass that is plentiful and bright green. Store grains securely, such that horses cannot gain access. In the case where a horse gains unrestricted access to grain, call a veterinarian immediately. Do not wait for signs of laminitis to appear. If you have a horse with laminitis, consult with your veterinarian to determine any special care that may be needed. Horses that have had laminitis are at an increased risk of developing the disease again, and the condition can become chronic. And you will want to ensure communication between the veterinarian and the farrier to determine whether corrective trimming or therapeutic shoeing may be needed. We have now reached the end of Part 2, and you can proceed to Part 3, which will cover health monitoring and health management of equine.